Hello guys, today we have with us Dr. Ryan, DPT from Washington, USA. In this interview, we will try to know everything about him and his passion. Hello Dr. Ryan, how are you?
I'm doing well. How about you?
Even I am good. And what about the COVID-19 thing? Are your people safe?
Oh, it's taking its toll definitely on the healthcare system around me. My fiance is an OR nurse, and she works in a big hospital system, so they're pretty overwhelmed with COVID-19 patients, and it's definitely hitting its peak where I am. How is it where you are?
Our people are also safe, but there is a lockdown over here. Everything is closed. The shops and everything, the hospitals, the colleges, everything is closed.
Oh wow, jeez. Yeah, I hope we can return to some level of normalcy soon.
Yes, we will fight against this.
Yeah.
So my should we start with the question answer session?
Yeah, that works for me.
So my first question to you is, how did you develop interest in the field of physical therapy?
So when I was a high school and college athlete, I was a wrestler, and in my junior year of high school, I developed a rotator cuff and labral tear. So I had to have a Bankart and rotator cuff repair, and then after that, I had several months of physical therapy, and ever since going through that, I developed an interest in the field. So I did some shadowing of local physical therapists while I was in school, and then ultimately decided that's what I wanted to do for my career.
Okay. So my next question to you is, tell us something about your daily routine.
So right now I'm in the middle of opening up a clinic inside of a gym where I'm located, but that's kind of on hold because of COVID-19. Before this, I would typically get up in the morning, get ready for the day, go to the clinic where I work to treat patients from usually around 7 to 5 or 7 to 6 or so. I would leave the clinic, go work out myself, head home, get prepared for the next day, and then start all over again.
So as the name of your Insta ID is the Barbelldoc. So
Mhm.
why do you prefer barbell training?
So my mom is a personal trainer, so I grew up weightlifting since I was probably 13 or 14. So exercising and weightlifting has been a passion of mine for quite a while. Um, Over the years, I've compete or trained in Olympic weightlifting, powerlifting, and other styles of barbell training. So something that I've always had a passion for myself. And I found that when working with these various types of barbell athletes, they're often underserved by physical therapists and other people in the medical community just because they don't have that understanding of the sport and kind of what it entails. So I really wanted to help and focus on that segment of the population as far as with physical therapy and the social media aspects of it.
Okay. So my next question to you is, when did you start weightlifting?
I started with general weightlifting probably when I was about 13, so it was right before I entered high school. I did the traditional bodybuilding type stuff that you would most young teenage guys would do when they first start. And
Right.
then when I got into college, it focused more on strength training. So that's when I turned to the actual Olympic weightlifting portion, powerlifting. And right now, when I do have access to gyms, I kind of train in a combination of both. So I do a little bit of Olympic weightlifting, a little bit of traditional powerlifting, and kind of mix the two up like that.
Okay. So what are the commonest injuries that are seen in the barbell athletes?
As far as Olympic weightlifters, the most common are probably knee injuries such as patellar tendinopathy and shoulder injuries like subacromial pain syndrome, just because they spend so much time squatting and doing various forms of squatting that a lot of them develop overuse injuries of their knees. And then with a lot of the overhead work, like the push presses, the jerks, the snatch, there's a lot of strain on the shoulder. So if you don't have really meticulous programming as far as the exercise goes, some of them can develop injuries there as well. On the powerlifting side of things, the most common that I probably see is probably low back pain, just because of how much volume they do with both squatting and deadlifting.
in the power lifting.
Mhm. Yep, exactly.
And I have seen recently barbell training is very famous within celebrities from Hollywood and Bollywood. What is that one best thing in that barbell training?
I feel like for me at least, the best thing or the most important aspect of barbell training is the sense of like self-efficacy that it permits people who do it. So when you first start training, barbell training can be very intimidating. Looking at people lifting huge weights is kind of scary for some people. And once they actually start training themselves and start to get stronger and develop these various qualities of athleticism, it's really empowering for a lot of people. You just have to make sure that you do it with guidance from a knowledgeable coach who can like show you how to do proper programming, proper weightlifting technique, and that sort of thing.
Okay. So, what mistake does some of the weightlifters do, heavy weightlifters do, which leads to severe injuries?
Mm. Yeah, it certainly can. I mean, severe injuries are, aside from traumatic injuries like accidents that happen in the gym, they're a little bit less common in barbell sports just because most of what we get are more overuse injuries. But if you have somebody who's starting to develop an overuse injury and they just continue doing what they've been doing and keep on beating on it, then it certainly can turn into a much worse scenario. And that's kind of hopefully where I come in and I can stop a barbell athlete who's coming to see me from transitioning from that really minor irritation to severe injury or something that really hampers their day-to-day or training activities.
And how important is core training according to you?
It's very important. I mean, my schooling is what gave me the foundation to know how to interact with patients, how to evaluate them, and do objective tests and measures. The most important thing that schooling can do is teach you how to communicate with people and then screen for those red flag scenarios where you should refer that person out if you suspect any sinister pathology.
And what has been your hobby?
My biggest hobby since getting out is still weightlifting. I try to exercise 4 or 5 times a week if I can. Right now, with all the gyms being closed, that's a little bit harder. So we're all stuck doing exercises at home. So you have to be a little bit creative with that. But that's been my big hobby since getting out. I used to also do things like jiu-jitsu and boxing, and I would love to eventually get back into that. But those just take a lot of time, and at the moment, I don't, I don't have enough of that. So.
Yeah. And who has been your inspiration and why?
I have a couple of sources of inspiration in the physical therapy world. A big one is Dr. Quinnipiac. I'm not sure if you're familiar with him. He runs a group called Clinical Athlete. So that group has sort of championed the care of athletes from the side of physical therapy. So he is also a fellow Olympic weightlifter. And him and his group put out a ton of really good information about how to communicate with these athletes, how to treat them, how to manage them while they are dealing with injuries. So they are certainly a big inspiration of mine. The other is a group called Barbell Medicine here in the States. And they're a collection of medical doctors, physical therapists, chiropractors, and other healthcare providers that also focus on barbell athletes. But they do a good job of trying to really stay evidence-based and look at the research and break down some of the more common myths that pervade physical therapy and healthcare in general.
Okay. So, when it comes to the treatment part, what are you best at?
The thing that I pride myself best on is knowing how to take somebody's weightlifting program, whether they're doing Olympic weightlifting or powerlifting, and modify it to the point where they can still get a good training response from their training while respecting the injury that they're dealing with. So,
Physical therapy treatment part, I'm asking.
okay.
Treatment.
Yeah, as far as PT side, it's definitely the exercise prescription. I try to make what I have my patients and athletes do in physical therapy mimic as closely as possible as what they would do during their regular training. So if I'm working with a power lifter, then a lot of my treatment for them on the exercise side of it is going to be variations of the exercises that they would be doing in the gym. So I really try to mimic it and make it as applicable to their training as I can.
And manual therapy treatment? Any?
Yep. I still do manual therapy. I do joint manipulation, joint mobilization, all that sort of stuff. In the recent years, I've been doing a little bit less of that and a little bit more of education and exercise, but it's something that I still absolutely do employ with my patients.
And what will you tell about the new techniques that are coming, like dry needling, cupping? There is ISTM, instrument assisted soft tissue manipulation,
Yep. So
taping.
I'm certified in dry needling myself, so that's something that I also use with. I have somebody who's coming in for like a soft tissue injury. Same thing with ISTM. I don't have much experience with cupping. I've only been to one clinic where they utilize cupping a little bit, and it's just something that I would typically use ISTM or dry needling instead of that.
And even taping is good, right?
Yep.
Taping, kineso taping.
Yeah, I definitely do a lot less of that stuff now than I used to. When I first got out of school, I was very manual therapy, hands-on oriented. And now I've switched a little bit more to the exercise and education part of it, but I still use manual therapy. I just make sure that I explain well to my patient what I'm going to do, what that hands-on work actually does, and all that sort of stuff.
So my last question to you is, can you give our audience an advice to be successful in the field of physical therapy?
Absolutely. In physical therapy, because it is such a wide field and there are so many different locations and settings in which you can practice, you really need to find the location or setting that you value most. For me, it's the outpatient orthopedic field and specifically working with athletes. So you need to find the patient population and setting that you're passionate about, and that will allow you to not only thrive in that position, but also avoid burnout and all those negative things that happen to a lot of newer grads and newer clinicians. Besides that, the best thing you can do is keep reading research. We always have to stay on top of current research and making sure that we're as evidence-based, everything like that as we possibly can as healthcare providers.
So as you are wearing a full sleeve t-shirt, I can't ask you to show your tattoo. We have seen your tattoo on your left arm, and it's really good.
You want me to take this off and show it there?
Yes, please, if you can.
Absolutely. Yep, that's the tattoo on my arm.
What is the tattoo about?
So the tattoo itself, the tattoo itself is a Polynesian design, and it's the symbolism in the tattoo is a lot about family and that sort of thing. I'm not Polynesian myself, but I've really admired that culture for a long time, and I like the symbolism behind the tattoo and what it stands for. So that's why I ended up getting it.
So Dr. Ryan, have you ever been to India? Have you ever visited India?
I actually myself haven't. I've always wanted to. I've heard a lot of good things about it. A couple of my mom's clients are actually from India, and they go back there probably twice a year, and they always love it when they go there. So it's definitely a place that I've always wanted to go to and visit.
And do you watch any Bollywood movie?
I actually have never seen one. No, I've seen little clips here and there on the internet, but I've never actually been able to sit down and watch one in its entirety myself.
And do you know any Bollywood actor? Any actor from Bollywood?
I can think of a couple. I can see their faces. I just can't think of their names. But if you do have any good movies or actors that you would recommend looking at their work, I'd be more than happy to look into that.
I'll send you the links so
That'd be
you
perfect.
watch the movie. There are many great motivational movies.
I can only imagine.
So Dr. Ryan, coming to an end, and we thank you for your valuable time, and we hope that you stay safe and your people stay safe over there. Thanks for your time. It is really an honor to interview you.
Thank you for having me on. It was a pleasure talking with you guys, and I hope that you all stay safe as well in this this all passes and we can get back to normal.
Yes, sure. Bye-bye. Take care. And thanks a lot.
Have a good one, Dr. Gufran.
Have a good time.